Once again, here we go. Respiratory system, as simple as possible, as awkwardly simple anatomy and physiology. Here's our fifth kind of take on the thing. Again, just a review of the materials that are available in the general practice questions, power quizzes, guided reading, PowerPoints from the chapter, the textbook itself, etc., etc. Well, here are some notes that I think are out there online and that some people have been looking at. So let's sort of run through them real quickly and see what they might say for us. Right off the bat, it is just a review. It's scribble notes. So we're going to talk about the organs of the respiratory system: nose, pharynx, larynx, trachea, bronchial tree, and lungs. And of course, people would consider the pharynx to be your throat, the larynx to be your Adam's apple, if you want to say that, or your voice box. Your trachea is your windpipe. So again, keep it in simple terms. That's what some folks would recognize. The conducting zone, we mentioned that before, and here it comes again. It's where you conduct the air from the atmosphere down towards the alveoli. You clean, heat, and humidify the air while you're bringing it down towards your very sensitive alveoli. The conducting zone includes your nose, your mouth, all the way down to the terminal bronchioles. The respiratory zone, well, that's where you actually exchange gases between the air and the blood. And it is the respiratory bronchioles, the alveolar duct, and the alveoli. So again, up here, you're just moving the air back and forth in bulk. Down here, you're actually exchanging gases between the atmosphere and the blood. General features of the right lung right here. Again, it's got 3 lobes, superior, middle, and inferior. It's got 10 segments, 2 fissures, the oblique and the horizontal. The left lung right here has 2 lobes, the superior and the inferior. It has 8 to 10 segments, generally 8 when you're younger, 10 when you get older, although books tend to waffle on that. There's 1 fissure, is the oblique, and it does have a cardiac notch in it. The indentation on the medial surface where the heart skews over towards the left. As far as surfaces of the lungs, there's the costal surface, the largest, which is anterior, lateral, and posterior. Again, means up against the ribs. Diaphragmatic, which is the floor, of course, on top of the diaphragm. Then the mediastinal. The mediastinal is towards the middle. It's where you find all the plumbing going in and out of the lungs. Other external features include the apex, which is the very top part of the lungs, and the apex is right up there at the first pair of ribs and slightly above. So strangely enough, sometimes a pain that's coming from the base of your neck, it feels like it's behind the clavicle. It might actually be your lung that you're feeling right there. The base of the lung is the part that's on the diaphragm. The hilus or hilum is that notch on the medial surface of the lung where all the plumbing goes in and out, where the bronchi go in, where the pulmonary arteries go in, where the pulmonary veins come out, again, lymphatics, nerves, and all that kind of stuff. Now, all that stuff that's moving in and out of the notch collectively is called the root. So the root includes the blood vessels, the bronchi, lymphatics, nerves. There you go. It's the plumbing. But the hilus or hilum is just the notch. And again, we've seen this word being used several times in talking about the notch in the side of a lymph node, the notch in the side of the kidneys. Very common phrase. Okay, the pleura. The pleura represent a protective bag that each lung is found inside of. An analogy that has been used, say way back towards chapter 1, is imagine you had your fist right here and there's a balloon and you pushed your fist into the balloon. The balloon would conform to the surface of your fist, but then there would be an outer edge, and between the two there would be an airspace in that analogy. Well, coming in a little closer right here, if we were talking about something like the heart, we said the heart is pushed down into a balloon-like structure, and that's called the pericardium. And where that pericardium is up against the surface of the heart, we call it the visceral pericardium. On the outside edge, that's called the parietal pericardium, and between the two, the pericardial cavity. Well, the same analogy works for the lungs right here, except rather than having the pushing from the top, it's sort of pushing from the side. And again, what you got right here is the visceral pleura directly on the surface of the lungs, the parietal pleura on the outside edge, and between the two, you have the pleural cavity. All right. While we're in this neighborhood right here, we've identified the visceral and the parietal pleura. We identified that there is a pleural fluid inside the pleural cavity, and it acts like a glue, and it also acts like a lubricant. And so we have to introduce these two terms here, adhesion and cohesion. A real simple idea, but it's used all over the body. Let's say in this diagram right here, this represents the stroma, the bulk tissue of the lungs. Here is the visceral pleura on the surface of the stroma. Here is the pleural cavity, and out here is the parietal pleura. Outside the parietal pleura, if we're talking about laterally, costally, you've got the ribs, and between the ribs you have connective tissue, you have muscles, such as the internal and external intercostals. All right, so the parietal pleura is connected to this wall on the outside, and the visceral pleura is connected to this material that actually makes up the lung itself. Between the two is the pleural cavity, and the pleural cavity is filled with a water-based solution. Now, when it comes to water, there's two very important concepts, forces we have to talk about, and that's adhesion and cohesion. Cohesion, co means together. Cohesion means that water sticks to water. So water sticks to water. We see this when drops form perfect little spheres or circles and such. Adhesion. Adhesion says water sticks to other things, other materials. And this is what we commonly refer to. Ad, of course, means on. Yes. I like adhesive tape. This is what we're referring to when we say that water is wet. Water sticks to things. That's adhesion. Now, in the pleural cavity right here, there is a water solution. And where the water is up against the pleura, the adhesion of water sticks the water to the wall. However, towards the middle right here, where there's just water, water sticks to water by cohesion. So, adhesion is the water sticking to this inner wall, to this outer wall right here, and cohesion is water sticking to water. Now, water sticking to water creates a kind of a pulling force from one water molecule to the next. So this is like a rope in this direction right here. And here it is attached to a surface and attached to a surface. So this acts like a rope in this direction. It pulls in this direction. But in this direction, the water can tumble. And because the water can tumble in this direction right here, it acts like a lubricant. So when a person inhales and they lift their ribs up and out, this wall right here not only moves outward, but it moves up at the same time. So the parietal pleura moves out and up at the same time. Well, the visceral pleura doesn't do that. The visceral pleura basically just moves in and out. The reason why this is possible is because of the cohesion and the adhesion pulling straight across here. So when the parietal pleura is pulled outward, you pull the lung outward. But when the ribs and the parietal pleura move up while moving out, the water in the middle has the ability to tumble. So therefore, you're not pulling the visceral pleura up and out. You're just pulling it outward. Generally speaking, you're just pulling it outward. So again, that's the reason why the fluid inside the pleural cavity is so extreme.